I would agree it is indeed critical that everyone recognises the importance of our own personal actions in controlling COVID. But we also need an efficient test, trace and isolate system. And the first step of that is to actually get access to a test. With UK cases trebling over the last fortnight, demand has increased, and there have been many reports of people being sent hundreds of miles to get a COVID test. One of the most extreme included someone in Plymouth being sent by the booking system to the test centre in Inverness. I understand that demand varies depending on local incidents, but surely it's dangerous to have possibly infectious people travelling long distances when they're unwell and may need to use motor services facilities on the way. So would it not make more sense to still allow COVID tests to be taken locally and just shift the samples around the UK to the labs with greatest capacity? While the commercial Pillar 2 testing has increased dramatically since April, the laboratories are very centralised. NHS hospital laboratories are far more numerous and based within easier reach of communities. So to meet the high demand that's likely this coming winter, will the Secretary of State consider additional funding to the NHS to allow expansion of their PCR facilities and maximise Pillar 1 testing capacity?
Secretary of State. The answer, Mr Deputy Speaker, is absolutely yes to that last question. She's quite right that expanding the NHS capacity as well as expanding the so-called Pillar 2 capacity is right. And I think we sometimes have robust exchanges, the spokesperson for the SNP and I, but on this she's completely right. It's an and together strategy of having the Pillar 2 mass testing across the board and expansion of NHS capacity. And I'm working as closely as I possibly can with Jean Freeman, my opposite number in the SNP government in Edinburgh, to deliver that as effectively as possible right across the UK.
So Edward